This session is going to focus on prevention and intervention. We have interventionists up here. We have a range of different co-occurring and syndemic relationships that our experts study and develop interventions for. And we're going to get a little bit into the policy discussion, but more is coming in the following session. And I'm going to hand it over to Maryanne.
Good morning. It's good to see you, so many of you back. For those of you who are new, I'm Maryanne Culpepper. I am, I guess you could say, the journalist in your midst. I am a documentary filmmaker and writer. I was president of National Geographic Film Studios for many years and have worked a lot in public health as well. So this is an incredibly fascinating discussion. We have four fascinating and expert panelists with us today who will present multiple perspectives and experiences focusing on violence prevention. Let's see, we'll start with Kayla. Kayla Williams is a senior fellow and director of the Military, Veterans, and Society program at the Center for a New American Security, and previously served as director of the Center for Women Veterans at the Department of Veteran Affairs. In 2013, she was named the White House Woman Veteran Champion of Change. Dr. Kylan Hunter is the Vice President for Programs at Brady, a nonprofit organization dedicated to the prevention of gun violence. She is a U.S. Marine Corps combat veteran, having served multiple tours in Iraq and Afghanistan as an AH-1W Super Cobra attack pilot. She is an adjunct professor at Georgetown University's master's program in National Security Studies. Dr. Jamila Stockman is an associate professor and vice chief of global public health in the Division of Infectious Diseases and Global Public Health, Department of Medicine at the University of California, San Diego. She has conducted extensive research on HIV prevention and treatment in the context of violence against women, substance abuse, mental health, and social and structural factors. Her current work, funded by NIH and others, is in the U.S.-Mexico border region, Latin America, and the Caribbean. Dr. Suzanne Maman is a social scientist trained in public health and a professor in the Department of Health Behavior at the University of Carolina, Chapel Hill's Gilling School of Global Public Health. She has been developing and implementing HIV and violence prevention programs in sub-Saharan Africa for 20 years. Each of our panelists today is going to make a brief presentation, be followed by some comment, and I'll have some questions for them, and then we're going to open it up to questions and discussion with the forum members and the audience in general. So we shall begin, let's see, we'll begin with, Kylan.